I'm Twyla Williams, and I'm part of Health 459 class, and we are going to interview my sister, Tiffany Williams Spraggins, and we're going to ask her some questions about our project. Okay, Tiff, how you doing?
Fine.
Thank you for doing the interview. Okay, my first question would be, what do you consider to be old age and why?
I consider old age to be in 80s or 90s, around the 80s or 90s, when it truly becomes difficult to be mobile, and when it gets to that point, that's what I consider to be old age.
Okay, and because you can't move, is that why? Because then
Right. Mobility to me is a large part of what I consider to be old versus not old.
Okay, gotcha. Well, what types of things are you doing now to live a healthy life?
I try to pay attention to the things that I need to eat, but I usually fail in it. I more or less know what I'm supposed to be doing in terms of exercising and eating, and I keep making the promises that I'm going to do that, but actually I'm not doing what I'm supposed to do.
Okay, well that's fair. Okay, well what do you think you should do in future decades to live healthier or to be healthier?
Eat more colored foods, the things that are naturally grown, vegetables, drink lots of water, and get on an exercise regime. I do have a membership at a gym. It's sometimes difficult to get there and actually exercise, but I know that exercise needs to be a regular part. And if it's not there, then doing things like gardening, and working in the yard, I think is another way to stay active.
Okay. Well, how long do you expect to live and why?
I expect to live until at least 100.
Okay.
I've always had in my mind that I would, so it's always been a goal, and I think that I have the genes to meet that if I do the right things. I think I have the family genes to meet a century.
Okay. So on average, how old have the family members lived in your family?
On my mother's side, not in their 90s, probably lower 90s. On my father's side, they're upper 90s.
Okay. So what conditions, what age, and what contributed to the sickness or the death of those members that did actually die when they died?
Well, there's various things. There is some cancer. There were some cancer. Some people who suffer from cancer in my family, but there's also been a few heart attacks, some with high blood pressure. So there are those things, but I think some of those things can probably be controlled by diet for as far as prevention is concerned. But a lot of the ones who lived those older lives, they died of old age.
Okay. Well, what types of activities do you see yourself doing in other decades, like 50s, 60s, 70s, concerning like marriage, sex, activities? What do you
For a healthy lifestyle? Definitely, as I said, trying to maintain some kind of regular exercise regime, but more walking. One thing that I don't like about my neighborhood is that there's not as many sidewalks and everything, but I still think that walking is a very just a regular thing that you can do that's very healthy. Eating right, staying active sexually even into old age will I'm sure add years to my life, and just having a happy lifestyle. Perspective on life and the issues of life that come up tend to bring about a healthier mind and a happier lifestyle, and the relief of stress when you handle your problems in an easier way, or don't think so seriously about them. That also tends to add years to life, I believe.
Good. Okay, so last question: what do you wish you had done in your past, your youth, or when you were younger, in your areas of health, finances, education, whatever? What are some things that you wish you would have done differently?
Wow, I wish that I would not have gained 15 or 20 extra pounds for each of the children that I had.
Don't we all?
I wish that I had battled those battles when they were there, so that it wouldn't be such a big problem now to have to take off so much weight. That's probably my biggest wish as far as all of that's concerned. I wish that I had invested more, invested money at a younger age, that now and later would be maturing into something that was, more financially pleasing, I guess, to me than what I have available now. But to me, those are probably the biggest regrets in terms of overall health and lifestyle.
Okay. Well, guys, that's my younger sister, Tiffany. Thank you very much. And I'll talk to you guys later.